like to go ahead, since the chair is not here. My name is Nick Lutton, and I will be chairing the meeting. I'm the vice chair of the Behavioral Health Board. I'd like to welcome you all and start with officially start the meeting. And we're recording, yeah, Jeanette? Perfect.
Yes.
All right. I'd like to officially open the meeting at 3:30 p.m. Welcome, everyone. And Jeanette, could you start with the roll call, please?
Sure. Kylene Hashimoto. Nick Lutton.
Here.
Brooke Frost.
Here.
Carolyn Evans.
Here.
Mary Lou Browdy-Minkler. Debbie Zhang.
I'm here.
Susan Zhang. Stephanie Gutierrez. Donald Vanderheiden.
Hi, this is Stephanie. I'm here.
Thank you. David Thorne.
Here.
Okay, that's everybody.
Perfect. Thank you so much. And we're going to move on to item number 2, which is the review of the agenda by the Behavioral Health Board. As I know, item number 3 and 4 are kind of combined together, and I believe the board has had time. I don't know if it's had adequate enough time. That's going to be up to the board. But for the approval of the minutes for the April 20th meeting and from the minutes of the April 18th meeting. Has everyone had? All right. So I'm going to approve the minutes of the April 20th meeting and for the minutes for the May 18th meeting. Do I hear any objections to that? Perfect. Moving on to item number 5. It's a public hearing presentation, the Mental Health Services Act, annual update and prevention early intervention evaluation report. And Ahmad from the Department of Behavioral Health will be presenting to us. Ahmad, thank you so much, and I like your tie.
Oh, thank you, Nick. Little summer festive, one with some flowers.
You look a lot better than I do, so.
All good. I've been running around all day, so I had to look the part. I'm going to attempt to share. Hopefully, I can work these items out. Looks like it is. So I'm going to share with you all just a PowerPoint. This is going to be a couple of slides, and this hearing really is going to just take a few minutes. Really what it is, and I do want to just note that we had done an annual update public hearing in February, and we went through the whole process, and then we were getting ready to submit our annual update to the board when we realized that, we also have our PEI evaluation, looked at some of the regs, and decided that we wanted to do this combined because we had to submit it combined, but wanted to make sure that we provided the public opportunity, which I'll dive into in a second. I do want to just note that we, as a department for the past year, have been starting any kind of formal hearing or meeting with the public, just doing our local land acknowledgement, and just reminding people and just acknowledging that where Fresno County sits today is on what was the traditional lands of the Yokuts, Western Mono Manachi, Eastern Mono Manachi, Nemu, which is also known as the Northern Paiute, Ohlone, and the Chilean peoples. And to this day, it's while people forget or maybe not familiar with these native tribes that once, had these lands, they are still on these lands. They still are involved, and they still definitely need for us to continue to try to support them and serve them in the most culturally responsive manner possible. So that's one step is us just doing the land acknowledgement to letting everybody know that where we're sitting today is traditional Native American land, and at the same time acknowledging those people that they're not forgotten, and we do still strive to support them in a way that is culturally appropriate for them. So just real quick, why we're doing the public hearing. So all MHSA plans, whether they're a 3-year plan or an annual update, do require for us to go through a stakeholder process. The stakeholder process is twofold. It's, well, threefold actually. It's having the stakeholder engagement. After that is posting the plan or the update for a minimum of 30 days for public comment, and then having a public hearing. And as I mentioned, we had done this with our annual update back in February, and everything was set to go. And we're getting ready to submit it to board in late April. And we also had at the same time our MHSA PEI 3-year evaluation plan that was done, that we were planning on submitting once that was finalized and cleaned up. Our team did do a quick review of the regulations, which I have cited there, and it actually requires that the PEI evaluation reports have board approval and be submitted as part of either an annual update or a 3-year plan. So with that in mind, we did not feel it would be appropriate to just say, well, we already got the annual update approved, no biggie, submitted. So we went through the whole process again of reposting the plan for 30 days, this time with in 2 versions. So we had one where it was the combined, and then we had a link where if people just wanted to see what the PEI evaluation or the new component was, that they could review that. It's about 90 to 100 pages of new info. It's very specific to like the PEI evaluation, but we felt that that does change what the public had weighed in on and had viewed. And so we launched a new 30-day public comment. We're having this public hearing, and our goal is to get this to our Board of Soups next week, and so it can be finalized and approved. During this past 30-day public comment, which actually from the date of posting to today is actually closer to 6 weeks. So we've left it open far longer. We've not received any public comments, and that's probably because the annual update that everyone had reviewed back in February, nothing has changed to that. We did nothing to that document. And our PEI 3-year evaluation that's required by the PEI regs is done by us by a third party that did an independent evaluation based on what's available, and then submit that to us, which we're combining into here. So it's a third party evaluation, so we really can't change it, nor should we be changing it. It should be what's in there. So I think that might be the reason why there wasn't a lot of feedback, because there was not a lot of change to the annual update and the evaluation. If we get feedback, we will document that. So any comments we receive today will include in the appendices. But if someone says, I disagree with that evaluation, the only thing we can put is Nick disagrees with that, evaluation, and that's the comment. We can't go and change the actual evaluation. That's the whole reason why we do the third party evaluation. Going to wrap up here. So the annual update and 3-year plan, as I said, there's been no changes to it. It's been posted for almost 6 weeks now, probably a little more. The big challenges is the way DHCS is instructing counties now, and really they're starting to, I don't say enforce, but they're really starting to look at that area, is making sure that counties have their plans in time, they have them in place, because that's what technically drives your spending authority. So in this case, if we don't have our annual update submitted, approved, before the end of the fiscal year, let's say it takes 2 weeks into July, according to the regulations and DHCS, we don't have any MHSA spending authority until that plan's approved. So we would technically not be authorized to render any services or pay for services in those 2 weeks. We're trying to avoid all those things, which is why we've set a lot more things in place. Like I said, if it wasn't for this is our first PEI 3-year evaluation that we're submitting. So if it wasn't for this would have already been approved, 2-3 months ago. So that's really the importance of it. But we, again, felt that this is important enough, and we want to be transparent enough to where, even though we're up against that kind of like short window, we really did feel we needed to go back out and do the full 30-day, allowing the public to see it. And again, bring this to your board and allowing the public to make sure that we had that hearing and voices are heard. So if you guys see on the screen right there, it does have just some information on the PEI regulations and evaluation. It is something that's required. It's a 3-year evaluation. There's some difference in opinion between some of the counties and some of the regulations in terms of having the 3-year plans like overlap and not coincide with every 3-year annual update. But that's just something that's the way the regs are currently at this point. We did use a third party in evaluation of these programs. And really this is why that data collection for a lot of our vendors and CBOs is really important, because without having data or good data, it really does become difficult to complete those evaluations. And so in addition to doing the evaluation with RAND for the PEI, we work with RAND to help us set up systems with our programs and CBOs so that we can make sure that we are getting that valuable data that we need to be able to show and demonstrate where programs are really effective. And if there's areas where they're maybe not as effective, we can address that early on and be able to make those improvements. So next steps, we've done the 30-day public comment period. We're having the public hearing right now. It is our plan to have this, everything is pretty much done. We're just needing to finalize this public hearing to have the annual update and 3 evaluation before our Board of Supervisors next Tuesday to have that approved. And at that point, we will submit those to both the Department of Healthcare Services and the Mental Health Services Oversight and Accountability Commission.
Amon, I apologize for interrupting you. Are you trying to share your screen?
Yeah, was it not showing?
We're not.
Yeah, we're not seeing
We're
anything.
not.
It's a lot of
I
useful
thought,
information, but we're not seeing anything.
okay, let me see if I can. Here, I couldn't see anyone because I had the full,
Yeah, in presentation mode.
yeah. So I was like, oh, I can't see anyone, so I can't even see people's reactions. Why is it not doing that? Oh, there. Let me try this real quickly and see if, are you guys able to see that now, Nick?
Yeah, if you put it in presenter mode, then there we go. Perfect.
Okay. So my apologies, people. I was trying to get through this quickly, but I promised Carolyn I wouldn't speak fast so that we could make sure that people could grasp everything. And then the aid I thought I was going to use in that the PowerPoint wasn't even up. So that was the land acknowledgement we had discussed. This was where I spoke a little bit about the why we had the public hearing. So if you guys can look, and hopefully my cursor shows, this right here is the area on the regulation where we found that the 3-year evaluation had to be submitted as part of an annual update or a 3-year plan. Our intent had been to submit the annual update, get that done, approved by the board, submit it to the state, have that out of the way, do our PEI plan, present it here to the Behavioral Health Board, present it to the Board of Soups as more of a study session type info, and then get that submitted. And then we realized that the regulations actually require us to do that together, which completely changed our timeline. Let me go to this other slide, Nick. So yeah, this was where I was just kind of giving you guys as far as some of the dates of when it was posted. When we, in theory, our 30-day public comment period would have ended May 27th if we went exactly in that time period. But since this public hearing wasn't going to happen until a few weeks after that 30-day public comment, we didn't see any harm in leaving that open. So up as of this afternoon, we had not received any public comment, but we wanted to make sure that this was available for people to still submit comment even before today's meeting. And again, like I said, I can't speak to why people maybe haven't, but my first, maybe my first, I won't say assumption because there's a whole thing with that one. My presumption would be that because there was no changes to the annual update, people probably maybe took a look at it and saw it was the same. And the evaluation is that it's an evaluation. It's not something that we can really change, that people hopefully got a chance to review it, looked at it, but didn't really feel that there was anything that they really needed to address. And probably are waiting for our new 3-year planning process that'll start in the new fiscal year, where they'll probably give us a lot of ideas and feedback and comments. This right here was, I think, Nick, where you notified me that my screen was not sharing. So it's just a next step. So we've completed the public comment period. We're bringing this for the public hearing and for your board today. We plan to hopefully we're doing everything possible, make sure we get this to the Board of Soups for Tuesday. And then from there, we'll submit it to the Department of Healthcare Services and the Mental Health Services Oversight Accountability Commission. The Department of Healthcare Services is more interested in our annual update because they, like I said, utilize that as to justify that we have spending authority to do that. The OAC is more interested in our MHSA PEI 3-year evaluation because that's one of the areas that they have oversight over. So they're really more interested, I think, in that. So we'll have it together. We'll submit it to everyone. So both agencies will get both versions. And if they want us to separate it out, which they've done from time to time, we have that version of it as well. And then if there's any information, questions, anything like that, people can always go to FresnoMHSA.com. If you use that link, it'll bring you, or use that web address, it'll bring you to the department's page on the county page, but it'll bring you specifically to our MHSA page. And it's a really easy way to find our MHSA related information. So you're not having to go to the county website, find DBA, try to figure out where's the MHSA. There's Fresno MHSA will bring you there. So our plans, our annual updates, those things are always on there. And there's also short videos to provide just information on different components. And anytime anyone's got any inquiries or questions regarding MHSA, we've created an easy to use email there, which is just mhsa@fresnocounty.gov. So with that, I will stop screen sharing. Hopefully nobody needs to see, go back any slides. Apologize for it. Like I said, I literally thought everybody was watching what I was watching. And see if there's any questions or comments that we can take down, or if there's anything that we need to address at this point.
Thank you, Ahmad. Right now, we'd like to open it up for any public comment. If you're on the phone, you can press *6, which will unmute you. But as Ahmad has said, we've had no public comment on this matter. And so if there is any, now is the time. So please, public comment.
Good afternoon. This is Ron Alexander. I'm with the County Administrative Office.
Yes, sir, Ron.
Afternoon. I'm new to behavioral health. I'm back. I just wanted to note that I do see that agenda item that you mentioned that's going before the Board of Supervisors on June 21st. So it is approved and ready to go. So there are no issues as far as getting that before the Board of Supervisors this time.
Thank you, Ron. And I saw you on there. I was like, that's got to be the same Ron from the CAO's office. So this will be good, because if we're off, he'll probably tell us, like, guys, you need to get some stuff in place. So
I'm here to support.
Awesome, sir. And once our annual updates and plans are done and they're finalized, they will be on that MHSA, Fresno MHSA page of our website. And so what we're trying to do is actually archive everything going back. So if people want to go back and look at a number of years ago, they can go and look at those things. But this is really us putting this year to bed, and really then start focusing all of our efforts come July 1 on our new 3-year plan. And I think now with, again, I know numbers keep changing with COVID, but we're hoping that this coming year we'll be able to have more opportunities to go back to doing some of those in-person community forums and engagement, and still have the virtual and still have the surveys. But I think we're, being able to make sure that more people get to participate, and if they feel they can be heard better in person, we want to be able to afford them that this coming year.
Sounds good.
Any further public comment? Any discussion by the Behavioral Health Board? Or questions or comments from the board?
Thank you for all your work and getting this in on time. Appreciate it.
We got a good team. Put a lot of work into it.
I move that, is it okay if I make a motion?
Yes.
I move that the Behavioral Health Board support the approval of the MHSA annual update and the Prevention and Early Intervention Evaluation Report.
I have a motion. Do I have a second?
I, Debbie Zhang, second.
Perfect. Jeanette, can we take the roll? Can't hear you, Jeanette.
Sorry, thought I was muted. Eileen Hashimoto? Nick Letton?
Aye.
Brooke Frost?
Aye.
Carolyn Evans?
Aye.
Mary Lou Browdy Minkler? Debbie Zhang?
I.
Aye.
Susan Zhang? Susan Zhang? I don't know if that was her I was hearing or not.
She said yes in the comments.
Okay. Sorry, I didn't look at that yet. Stephanie Gutierrez?
Yes. Oh,
Donald
yes.
Vanderheiden? David Thorne?
Aye.
Okay, that is 7 in favor.
Motion passes. Thank you, Ahmad, for all of your hard work and your department's hard work. We appreciate it, and we appreciate getting everything in. Moving on to agenda item number 6, the Department of Behavioral Health's update with Ms. Holt.